there are two sides of the same coin. This is actually the same thing as the equation we just saw, because we need to do on the left reducing unsustainable population increase, no debate. We also need to reduce the overconsumption of resources. And that can be done two ways, by reducing per person consumption and by technology. Let's be in favor of technology. I think it's wonderful. I love watching widgets and fix-its on programs in the old days like Tomorrow's World. You know, this is something we should all be excited about. But we've got to do all three. The two on this side, which is the T factor plus the affluence factor, and the one on the left, which is the P factor. So we all need to reduce our consumption, and we need to do the 5 R's there, which is to refuse, reduce, reuse, repair, recycle, and bicycle. And I've come here today from Oxford by bike on my Brompton. Okay, I did hitch a small lift on the train. But I always go everywhere by bike. And I think actually in this room, perhaps we are so committed to the population thing, we don't overtly show our involvement as we should, I think, on this side as well. We'll be listened to more, folks, if we show by our lifestyles that we are really doing on the right at the same time as on the left. Otherwise, we could be accused of saying, let's have less humans on the planet, especially abroad, so we can continue consuming and polluting to heart's content. Have you ever been accused of that? It's a dreadful accusation. It mustn't be true. We must do our bit as well on the right there, because it's an issue of equity. And there is that, that picture, I don't know if it's here now, I thought I had it, which is a cartoon of the ourselves, of population matters, which shows more and more humans pushing the rest of humankind off the plate. And we do that both by our numbers and by our excessive consumption. So there are many myths and taboos. The last 5 minutes of my talk, I want to talk about getting rid of the myths. And again, I hope this is revision for all of us in this room, but perhaps putting it together will help a bit, again, in our own presentations to other people. Myth number 1, population growth in the last 200 years has been due to a rise in birth rates. Absolutely not true, and yet is widely believed to be the case. The poor people are breeding like rabbits, etc. Actually, it all was caused by people like myself. It's doctors and nurses, the medical profession. It's an unintended consequence of death control. On that Population Dots DVD, you saw how it took off in 1850, halfway through the 19th century. That's when the handle was taken off the Soho pump by Dr. John Snow, and that was the start of public health to stop the cholera epidemic. And in fact, the total fertility rate of the planet has actually come down. There are fewer children per average family in the world now than there was when I embarked on this road. When I started, at the start of my professional career, the average family size was 5.2. The average family size of the world now is 2.5. So we've done something. That's a good news story. But of course, there is the problem of these countries here. And it is the most problematic with large family sizes here. But these ones here, like India and Pakistan, although they're not the greatest number of births per women, they've got such large populations that their impact on global increase is still huge. And yet we have this strange man, Fred Pierce. Have you come across Fred Pierce of PeopleQuake? His myth is, number 2, is that population problem is solved. He knows perfectly well it isn't, actually. I've had supper with him. He doesn't really believe that. But he writes it, and he's believed to be saying that. And he also fails to mention population momentum. The fact that because of high birth rates in the past, many countries have got a bulge of young people who, even if they were only to have 2 kids each, will increase the population of that particular land area by at least 50% before stabilization. It takes about 60 years, folks, from replacement fertility, which is 2.1 or so, to actually not increasing your population. It's 60 years after that, because it requires that amount of time for the bulge of people to work through the population pyramid. Another myth is so common, we've already alluded to it, that any quantitative concern about the numbers of humans on the planet is intrinsically coercive, that we are, just by virtue of being worried about the numbers in this room, all of us here are for coercion. You all feel that, don't you? People think that about us? Or exclusive of other critical concerns. You're going to give them condoms and pills and not give them food and healthcare. If I say family planning as well, why do people hear family planning instead? I've never said that, but that's what people hear, isn't it? It's as well, as well, as well. And in reality, the coercive story is nuts, because all these countries here, Colombia, Costa Rica, Cuba, Iran, Taiwan, South Korea, Sri Lanka, Thailand, Tunisia, even Kerala within India, managed to halve their average family size or total fertility rate in 8 years, the same time as China, without any coercion. So A, it's bad to be coercive, and B, it's completely unnecessary. And yet that's the myth that is often believed. And what did it? Removal of barriers to women. This is an interesting slide. On the same slide, you've got two countries. The bottom line there is China. The top line here is Iran, which is a pariah on the world stage. But it's in fact a success story in terms of family planning. And they woke up to the problem here and decided to bring in effective voluntary family planning. They realized that they were going to be in trouble with too many people on the planet. In the end of the 1980s it was. I can't see it very well at the bottom there. And they brought in 5 measures. They brought in family planning clinics around the whole country at health houses. They educated their women folk. So education is important. It was already 90%, and now is 90% female literacy in that country. They talked to their religious leaders and got the religious leaders to issue fatwas or edicts that family planning is not anti-Quranic. And then they actually brought in a simple little thing, which was you can't get married in Iran unless you do a short course in family planning first. Such a cheap and effective maneuver. You had to do that, a little course, before you got your marriage lines. And they empowered women. So barriers to women were removed. In China, Mao was very pro-natalist. He said every mouth has got 2 hands. And he was, and look how the actual family size went up there. Then, though, and this is very interesting, in China, they brought in a population media encouraging policy, not coercive initially, which was later, longer, fewer. And they broadcast that as the ideal. Get married later, have children later, have longer gaps between your children, and have fewer overall. And that did the main reduction in China's family size. So when they brought in their one-child policy, you can understand why they did, because they had that demographic momentum. They had all those young people already born. So although it was a disaster, and it would have been so much better to have had a 2-child policy much earlier, it was also not the main thing that worked in China. The main thing that worked in China was the later, longer, fewer policy before it.
John?
Time. Yeah, we will finish soon. So we get policies that it's anti-life and anti-human. We get told that. And that's a picture of my little granddaughter with her boyfriend. Definitely not anti-human. All we're saying is it's possible to have too much of a good thing. That's all we're saying in this room, isn't it? And it's a good guideline to have 2 offspring replacing yourselves. That's the thing to say to people. It's not a rigid guideline, but it's a logical one, because 2 is self-replacement as a basic guideline for family size. And that's the way to deal with these myths. There's an answer to all of them, but we need to be prepared with the answer. That's the way to answer that one. We're told it's anti-life, but of course family planning is hugely pro-life. We said that at the start. It's a wanted choice, a human right. Indeed, without this choice, northern women see that as an absolute routine option. It's not contraception, but conception that is coerced. Have you thought of that? Coerced conceptions are happening all over the world for lack of what we take for granted over here. Oh, that's the picture I was referring to earlier. Who are you pushing off the plate? It's a very good cartoon. Another myth, quickly, the dependency ratio myth. The developed countries, rich countries, need to have more children because, the old age pensioners need more young people to look after them. Therefore, you must have more young. What people don't realize is that if you really follow that policy, in a blink of time, which is 70 years, children become old people. So here you are with these old people here and too few young. So you have more young. Well, in 70 years' time, they're even more old. So you have to have even more young. And when they're all old, you have to have even more young. That's the way to deal with that one. If anybody talks about dependency ratio, use your arms like that and show it's a recipe for perpetual population growth. A recipe of that. It's a Ponzi scheme. But in fact, our whole environmental dilemma is a population scheme in the sense, is a Ponzi scheme because the people who suffer are down the road. And we are getting jammed today. Okay.
Last slide.
Yeah. I think I'll skip that one. The perceived wisdom of developed economists is that the poor try to have or set about having large families for help in the fields and to care the elderly. What is really going on? It's back to sex. They are simply having reasonably regular sex, as with opportunity most people do, and a large family just happens because to have a small family requires something to be present that isn't. What's that? Family planning, truly accessible, back to women, truly accessible to women. Which parents in this room who had 3 children, say, or 2, only had sex 3 times or twice? None of us. We have sex much more often. As a consequence, large families are the default state of humanity. They'll always happen when there are powerful barriers to family planning options and the correct information women need and deserve. If you're fertile, sex at normal frequency equals big family. Again, it's not rocket science. They aren't, these poor people of the developing world, deliberately setting out to have a big family. They may want 3 or 4. They don't want numbers 5, 6, 7, and 8 for sure. And I know that, having gone back many times to Africa and talking to women. There is opposition all around. We've got the religion problem. I told you how they dealt with it in Iran by having, by talking to the religious leaders. But the Holy See is a huge obstacle to the whole of this story, as you well know. And yet, total fertility decline, I really am finishing, has worked in the countries I just about got my last slide now. What we need is to get the media to be involved as well as to have education. There's a wonderful website you should visit called populationmedia.org, which is run by Bill Ryerson, which shows the absolute necessity of changing family size preference in societies through info entertainment, education entertainment, where the virtues and value of having small families gets across to the people in that way. I'm afraid you have humans. That's the bottom line. Our country.
Thank you very much, John.
Thank you very much.